This video will teach a provider how to set up the CPAP or BiPAP and get them ready for patient use. The BiPAP machine, or bi-level positive airway pressure machine, delivers air pressure at two different levels during inspiration and expiration through a mask. Most BiPAP machines can also operate in CPAP mode, or continuous positive airway pressure mode, in which a constant or unchanging positive air pressure is delivered to the patient through a mask. Before your new CPAP or BiPAP arrives, it is important to confirm that the clinical space it will be used in is ready for it. Several aspects of the clinical space will need to be examined. Determine where the device will be used in the clinical ward. This would include on which side of the patient the CPAP or BiPAP will be placed, location of oxygen concentrators or other supplemental gas device, electrical power connection within 1.5 meters, and any communication connections for central alarms or network connection. If the device is portable and contains a rechargeable battery, when deployed, it should be stored in a location with outlets for electrical charging. If you experience lots of power fluctuations, consider using a voltage stabilizer to regulate the power to the CPAP or BiPAP. If you experience lots of power outages, consider using an uninterruptible power supply, or UPS, of appropriate capacity to provide the CPAP or BiPAP with consistent power. Incoming inspection ensures a new CPAP or BiPAP is safe and ready to use on patients. It involves ensuring all components ordered are correct, visually inspecting the CPAP or BiPAP, confirming its safety and function are acceptable, documenting device data, and communicating with clinical staff the need for user maintenance and other key points. Acceptance testing involving safety and performance tasks is typically done by clinical or biomedical technicians, technologists, or engineers, but may be done by another technical or clinical professional at your healthcare facility if they have the right competencies. Regardless of where you are working, your workspace should be clean and free of dust and smoke-free. It must also be free of any oils, grease, and petroleum-based products, as these substances can ignite in the presence of enriched oxygen. Prepare your workspace by laying out your tools and test equipment that you will be using, such as lung simulator, ventilator tester if available, appropriate hoses and connectors, oxygen analyzer, stopwatch or a watch that displays seconds, pressure gauge or meter, and electrical safety tester if available, or DVM with patient load. Make sure you document the acceptance testing results in the database system you use at your healthcare facility to record device information, dates, schedules, and other data. If you don't use a database system, document the testing results on a checklist or paper record and file it in the equipment record. We will go over the setting up of CPAP in this video, and the same method applies to BiPAP. Now you are ready to unpack the CPAP or BiPAP and any other boxes that came along with it. The boxes may have been opened already by someone at your facility who received the shipment, just to verify the contents. Make sure your hands are clean by soaping and washing. Follow your facility or national guidelines and protocols regarding donning and doffing of appropriate personal protective equipment. For a global reference, visit the WHO website or enroll in an open WHO course on infection prevention and control. Open up the box containing the CPAP or BiPAP carefully. Open up the other boxes from the order and check the contents against the packing slip and the purchase order. Note any discrepancies or any damage to the device or accessories that may have happened during shipping and report it right away. The vendor should be contacted directly or through your administrative process. Make sure both the user manual and the service manual are included in the box. Some vendors provide the manuals on CD or online. Verify that the documentation is accessible. These are the essential parts of the CPAP and BiPAP therapy: the machine itself, tubing that connects the machine to the face mask, and the face mask that the patient will wear, which is attached to headgear. Check the voltage, current, and frequency requirements for the device. This is typically found on the metal faceplate on the back of the device or in the manual. Ensure that the electrical power is at the same voltage and frequency and the device's current requirements are met by the electrical distribution system. Also, verify the CPAP or BiPAP's electrical power cord plug is compatible with your electrical outlets. Now you are ready to test the performance of the CPAP or BiPAP machine and confirm it is within specifications. Electrical safety testing should be the first performance test. It is covered in a separate video, Electrical Safety Testing. To set up either the CPAP or the BiPAP machine, place the machine on the workbench or table. Keep the device away from any heating or cooling source, as well as any direct sunlight. Connect the tubing onto the device patient outlet port. Remember to never stretch, crush, or deform the tubing to avoid air leaks. Install the air filter if it does not come installed into the device. Now the machine can be turned on. Always turn the machine on before turning the oxygen on, and turn them off in the reversed order. Oxygen off first, then the machine. This is to prevent the oxygen from building up in the machine and to reduce the risk of fire. Review the user or service manual and confirm the operation of all lights, indicators, meters, gauges, audible signals, and visual displays. The first time a machine is turned on, it may ask for you to set the time on the machine. Different models have different ways of performing the performance tests. Some units have a self-test mode. Run the test based on the manual. Attach the device to a lung simulator and a ventilator tester device if available. Refer to the manufacturer's service manual for recommended settings and procedures. Tests should include pressure level, rate, inspiratory time, and fraction of inspired oxygen to verify proper operation and accuracy. Compare the setting with the values obtained on the ventilator test device. While most values should be within 10% of the CPAP or BiPAP setting, the pressure level's tolerance is 2 centimeters of water pressure. Using the same setup, now we are going to test the equipment in different operational modes. Set the unit to operate in CPAP mode. Verify the unit maintains pressure level and deliver a breath to test lung when it is triggered. Set the unit to timed mode and confirm that the device delivers breaths to the test lung at the set rate, inspiratory and expiratory time, and pressure levels. To check the spontaneous or timed mode, simulate spontaneous breaths by expanding the bellows of the test lung. Verify that an assisted breath is delivered in response to a breathing effort when the breathing circuit exceeds the sensitivity setting. Verify that an assisted breath is delivered within the set time when the sensitivity trigger has been exceeded. Also, verify that the unit maintains the inspiratory pressure and expiratory pressure levels for the set times. Set the unit to operate in BiPAP mode. Verify that the unit maintains the set expiratory pressure level, switches to the set inspiratory pressure level when trigger sensitivity is reached, and switches back to the set expiratory pressure level as described by the operator's manual. To test the pressure relief valve, block the breathing circuit while measuring the pressure at the blockage point. Run the CPAP or BiPAP at the highest pressure setting. The peak pressure should not exceed 60 centimeters of water pressure or the value specified by the manufacturer. Verify the alarms on the CPAP or BiPAP. Review the manual for how to test the alarms, and always follow the manual when it conflicts with these instructions. Not all alarm conditions can be simulated easily. Audible and visual alarms should be heard and seen, respectively, by clinical staff. If there is an alarm silence control, check that the reset feature works. Verify that remote alarms work properly. There are two types of alarms, clinical and technical. Both alarm types should be verified by following the manufacturer's guidelines as they vary according to the device. Many alarm conditions can be simulated using the ventilator test device. Example clinical alarms include high or low alarms for respiratory rate, volume, flow, and pressure. Disconnect the circuit at the patient connector to activate the low pressure alarm. Verify that the low pressure alarm activates audibly and visually, and that the alarm activates within the manufacturer's specified time delay. Reattach the breathing circuit and verify that the indicator remains lit until manually reset. You've now completed acceptance testing on your new CPAP or BiPAP. If the device did not pass the acceptance test, double-check the failed section of the test. If verified, the vendor should be contacted directly or through your administrative process. If the device passes, apply the asset tag to the device. If other labels are required, such as battery replacement date or warranty end date, also apply these labels. Be sure to record the work in the CPAP or BiPAP database computer or paper file. The asset tag, device type, manufacturer, model, serial number, and department location are essential with other important data to record being placed in service date, end of warranty date, device cost, maintenance provider, and preventative maintenance schedule. One final thing you should do is review the routine care and user maintenance procedures for the CPAP or BiPAP with the clinical care providers who will be performing these tasks when the CPAP or BiPAP is in use. These tasks will help extend the life of the CPAP or BiPAP. This video is not meant to supplant professional judgment and the need to seek the advice of clinical or biomedical specialists, particularly for discussion and evaluation of complex cases. World Health Organization expressly disclaims responsibility and shall have no liability for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information contained in this video. World Health Organization does not endorse specifically any device, company, test, guideline, treatment, or procedure mentioned in this video.